Hi, everybody. My name is Ryan Castleton, and I am a nursing student at Dixie State University. And I'm enrolled in Nursing 4020 Community Health Nursing course. And this is my community assessment project presentation. The community I chose to assess is Crescent Senior Living Facility. Right, this is a community for senior citizens and has many programs and amenities that cater to the geriatric population. Okay, it is a beautiful design, luxurious senior living community that has 108 beds. 74 of those are assisted living, 34 of those are memory care, and there are currently 53 residents living at the facility. Okay, and the list of amenities that this care facility has is very, very long, including cooking classes and book clubs, gardening clubs, a game club, a computer center, movie theater, beauty salon, many, many things. Overall, just a great place to live. Now, the problem is, right, that the pandemic COVID 19 hit the geriatric community very, very hard. They're at high risk for um, getting COVID 19, but also having COVID 19 have harmful effects on them. And so, care facilities are one of the communities that have been hit the hardest. And so, they are to maintain certain pandemic isolation precautions. Okay. Now, even though these isolation precautions are keeping them safe, it also causes a secondary problem, which is social isolation. Okay. Social isolation places a growing number of older adults worldwide at increased risk for hypertension, coronary artery disease, stroke, elder abuse, depression, and even suicide. Okay. When speaking with Community Liaison Director, she reported that even though they have gone through great lengths to adhere to the needs of each resident while maintaining safety precautions, there are still some residents who report being lonely and depressed. See, the problem is finding interventions and activities that reduce social isolation, okay, while maintaining pandemic isolation precautions, right, to keep them safe. So the diagnosis is the following, okay? Risk for loneliness related to sedentary lifestyle, fear, hopelessness, powerlessness, ineffective coping, social isolation, and anxiety secondary to facility and state required COVID 19 restrictions. Okay. Also, risk for ineffective coping related to social distancing and isolation secondary to facility and state required COVID 19 restrictions. Now, the goal for my assessment of this community and my interventions was to decrease the prevalence and severity of isolation related depression among the geriatric population that reside in care facilities, specifically Crescent Senior Living. Okay. The associated objectives include, of course, decreasing the risk of social isolation related depression, increase the number of coping strategies and interventions, improve the quality of life, provide social interaction alternatives, and assess available resources and distribute them where needed. According to Healthy People 2020, all right, there are two goals and objectives that are relative to my interventions in my community. First goal is to improve the health, function, and quality of life for older adults. Okay, so reduce the proportion of older adults who have moderate to severe functional limitations. This includes, okay, temporary limitations brought on by COVID 19. Second goal is to improve the mental health through prevention and by ensuring access to appropriate quality mental health services. The objective is to reduce the suicide rate, okay, which these social isolation cases have led to that. Which brings me to the interventions, okay? So interventions and activities aimed at reducing social isolation and loneliness are widely advocated as a solution to this growing problem. Okay? A range of interventions were described which relied on differing mechanisms for reducing social isolation and loneliness. Therefore, that's why you see 3 different types of interventions: Star Resident, Family Video Chat, and Parade, and I'll explain each of those. First is the Star Resident. Okay, the Star Resident program is a resident recognition program, which spotlights one resident each week. We interview them, their family, and present the information in a Star Resident newsletter that goes to all the residents. This newsletter includes favorites, hobbies, and memories. In addition to the newsletter, the kitchen will cook the favorite meal of the Star Resident in their honor. Okay, the Star Resident program allows residents to learn new things about one another, recognizes and validates individual residents, and encourages safe social interaction. Okay, and this is an example of one of the newsletters that went out. Okay, the Star Resident, a picture of them, okay, and all of their likes and fun memories. These are just the pictures that were associated with that newsletter, okay, when they were just younger. This has a very cute story. She was one of the first to get a 1964 convertible Mustang, and it's gold, and she was very proud of that, and it's very, very good looking. Family video chat. Okay, so in talking with the residents, the lack of time and interaction with resident families was one of the most reported hardships of the current isolation restrictions. Therefore, we wanted to help connect residents with their families. An assessment of each resident's capability, ability, and resources to FaceTime, Skype, or video chat with their family was performed. Right, some residents had smartphones, computers, or tablets, but others didn't. After assessing the needs of each resident, we either assisted them connect with their family, taught them how, or gave them the resources to do so. So currently, all residents have the capability to video chat with their families, which is such a blessing. There's just a few pictures of that. Last but not least is the parade. Okay, so a few months ago, my 6-year-old daughter was distraught when she was told that she would not be able to have her birthday party this year because of the pandemic. All right, so in efforts to eradicate this unfortunate circumstance, we organized a birthday drive-by where friends and family drove by in decorated cards to wish her happy birthday. This gave me an idea. So in coordination with the facility, we also performed a 24th of July parade for the residents. Now, these residents were lined up outside on the courtyard and we brought the parade to them. The parade included a fire engine, motorcycle police escorts, and lots of friends and family who decorated their cars. And so as we passed, the residents would smile and wave, as well as shoot a silly string at us. So here are a few of the pictures of the decorated cars that were in that parade. This is everyone just getting ready to go around the corner, all right, and enter into the facility grounds. This is just another picture of when we actually got to the residents. So as you can see, they're spaced apart, all right, and they're either with the person that they live with or a staff member, okay, and then the cars are just passing by and waving and smiling at the residents. Furthermore, these are 2 videos that just get a quick glimpse of how that parade went. You see here people waving and smiling. These are my references for the number of quotes that I used during the presentation. Okay, overall, this was a great experience. It was a great opportunity to work with these residents. They had such a good attitude about it, and they were so grateful to the facility and myself of the things that we were trying to do to help them still have a social life while staying safe. And so, thank you for this opportunity and thank you for listening. Island, that family used their van as a magic carpet. You see residents waving and blowing kisses. Okay. Everyone had a really good time.